Why is children's mental and physical health important to you?
What does it mean to me? A community that recognizes that every child and youth has strengths and potential to be resilient. Well-being is when a child or youth feels safe in their home, in their neighborhood, and is loved and accepted for who they are and their unique composition, which includes challenges and also assets.
I think it's our job as adults to make sure that kids have everything they need to grow up healthy and ready to succeed. To make sure that they have an adult who loves them, people to support them, so that they get the things they need to be physically healthy and to be mentally healthy, so that they can continue to learn and grow up to be successful adults and really great parents, because it's our responsibility, again, as adults. It's a cycle. We raise the next generation and depend on them to raise the generation after that.
It's important to me, and it's important to child welfare, because as we all know, children that come into our system already come with troubles and trauma and issues that they need assistance with. Children and youth are afraid, they're scared, they're confused. So we need to be sensitive as a system to all of that. We need to make sure that we keep in touch with what children and youth need to be successful, to thrive, and to do well while we are in charge of taking care of them.
A child needs to be healthy to function properly. The mental health is going to be, if they're not in a good mood, if they're in a bad mood, if they're feeling depressed, they're not going to be able to do what kids do. Sometimes that's just have fun. Other times it's to learn in school. But if they don't have that good base, they're not gonna reach their potential.
One of the things that we see today, 2015, in terms of kids that come into the justice system, is that a lot of the kids have had some mental health issues. A lot of the kids, frankly, a lot of the kids may come from backgrounds where they haven't had great health care. So they haven't, like, when I was growing up, my parents made me go to the dentist, took me for physical checkups and things like that. But there are a lot of the kids that end up coming into the juvenile justice system haven't had that level of health care. And so taking care of yourself physically, we know now has a role in improving lifestyles for kids that may come into the justice system. And we also see now in 2015, a lot of the kids that end up coming on probation have some sort of a mental health issue. And that may well be because some of the conditions that led them to being placed on probation. So part of our job, as you heard me say earlier, is to help kids and adults turn their lives around. So the more that we know about some of the mental health issues that kids may have, the better we'll be able to do our job. That's why that's important.
We're realizing that you can't just focus on the physical health of a child, you have to focus on the whole child, and that encompasses the mental health component as well. So when we, and I can speak from the First Five perspective, the earlier you can screen and provide early intervention services to make a child feel secure, loved, safe, then those are more likely that in the long run you're providing a really good foundation for that child to thrive.
The World Health Organization considers mental health to be a state of well-being where everybody can realize their own potential. They can deal with the normal stress of life, they can be productive at work and at school, and can make a contribution to their community. And I really like this way of thinking because it leads us to not just focus on the presence or absence of illness, but it encourages all of us to work to find, to become better versions of ourselves. And it allows us to help children reach their full potential.
I really take each of those elements and think about kids and how important it is for kids to be safe, how important it is for kids to be thriving, and how important it is for them to be healthy, physically healthy. And to me, that really encompasses what well-being and mental health means for kids.
We want to make sure that our students are doing well and ready to learn, and that we're addressing their mental health and their behavioral health and their well-being. That's really important. So we know that if students aren't feeling well, then they're not going to be positioned to learn. And really, our goal is to get them to learn and to prosper and to have success.
And I believe that all youth should have an opportunity to have the advantages that my kids have had in life, and in order to succeed, we need to pay attention to their emotional, mental, and physical health so that they can be productive in school, in relationships, in life in general.
It's my wish and my dream for every child to live to their fullest potential. And for people to live their fullest potential, they have to do well physically, mentally, and emotionally.
Because every child deserves to be happy and believe in themselves and the ability of being able to do great things in their life. And so if we take care of their emotionality, their mental health, and their physical well-being, then they can achieve those dreams, and we can be behind them in accomplishing their dreams.
How do you partner with systems to support children's well-being? Well, I deal with like the schools and the safety patrol, work with them, and that program gets me in with the kids, and I'll actually help them if they have any other problems outside of school, and you can tell when you talk to them if they have issues, if they have something going on. So to partner with the schools with the safety patrol is one way, and then in groups like Youth Voice, where I get to be, you can be one-on-one and talk to a kid that might need to just vent a little bit, and that might help them mentally be able to go back to their situation which may not be perfect, and they have a little bit more backbone, a little bit more strength to go deal with it.
I think one of the best ways that I partner is by making sure I'm really listening to the children, to the youth and the families. So being part of Youth Voice, I get to hear from all of you what's important, what challenges you have, what struggles you have, and what things give you joy and what things help you with your mental and physical well-being, so that then I can work with all the other systems, probation, mental health, law enforcement, and help create those programs that are relevant and appropriate and meaningful for you.
Well, I believe it's really important that all systems that serve children work together. And I think it's really important that we include youth in that. So I think it's really great that you're doing this work through Youth Voice, because the systems really need to hear young people. And when I talk about systems, I'm talking about the mental health system, the child welfare system, the probation system, the physical health system, and then the nonprofit system, or our own system of how we do things, and helping the youth and their families manage through those different systems.
Some of the partners are child welfare systems. We also work closely with probation. We work with regional center. We work with schools. We also collaborate with organizations that help amplify the children and youth voice, because it's really important to hear from those that we have the responsibility to serve and get their input about what it is that we're doing. We also partner with public health and really community members as a whole, and have opportunities to elicit input from the community, because everybody has a piece of the puzzle, and there are so many things that people do to support kids, and if we come together, we can create the most supportive system versus working in silos and individually.
From our home visitation programs, which start either prenatally, and they will work with a child and family from the ages of 0 to 3, as well as our healthy development services, who we work with the American Academy of Pediatrics and the community clinics throughout San Diego County to really assess and treat not only health issues, but also mental health issues and behavioral issues. Really the focus on early intervention. And then as well, we have where we work with our foster youth population in the 0 to 5-year-old age range through our DSEP program, and also through our Kids Start program here in San Diego County.
We partner with law enforcement and probation. We partner with many youth serving agencies, because we all have the same interest, to make sure that our youth succeed and to make sure that our youth prosper in our communities.
The probation department has to partner with community partners to support well-being, because it's not a job that we can do on our own. A probation officer has limited tools. So let's say that we have a kid who comes from a family where the father isn't there, and the mother has to work full-time. So what we look to do is to find partners in the community that can offer some support to that mother. Maybe that has led to a situation where that child needs some support from family counseling. Probation officer themselves might not be an expert in family counseling. So we look to establish relationships with community organizations that are experts in family counseling. We spend a lot of time working with what we call wraparound programs. Have you guys ever heard that term, wraparound programs?
I think I've heard it. I don't know what it means.
What that means is with the kids, you want to wrap them in whatever services that they need. And some of the wraparound programs that we partner with, the family will assign what's called a parent partner. So there'll be somebody to support the parent figures in that family. And they'll also provide what's called a youth partner, somebody to support directly the kid who is at the center of the family. So we have to work with organizations like that to support, just as you said, to support the child's well-being.
We get to work with families, we get to work with parents and children early, and we really spend a lot of time thinking about the social emotional development of kids, the stuff that we're talking about, emotions, so that when a child is learning how to use those emotions, a parent can help teach them. And if you learn how to use your emotions, then they can work for you instead of working against you.
Not everyone can do everything alone, and we all have different strengths and things we like to do and things we do well. And it's important that we know who has a strength in doing something, so that if we see a need or we see a child who may lack something, that we can turn to the person who can best give them that. And working together is the way that we're going to be the most successful. You know, we don't have unlimited resources. You know, there's often things we'd like to do and think that we could do better, but we have to work with what we have. And as a community, we have a lot of great strengths out there. A lot of great adults, whether they're in an educational setting like a school, healthcare like me, like a pediatrician or another doctor, community member, pastor, a leader at a church. You know, all of us have those strengths that we need to bring to kids, and you know, working together is the only way we're going to be successful to bring the things that people need and to learn from the kids too on the things that they're doing on that they're interested in, get excited about their passions.
Mm-hmm. So this is about agencies really all sharing the same values and principles about the importance of that every child, every family they work with bring to that relationship integrity and bring to that something to offer to make their lives better and make the community better.
We partner with the community in a variety of different ways. Because we know foster youth typically have some mental health needs that need to be addressed or emotional needs that need to be addressed, we really use our community partners and resources to look individually, youth by youth, child by child, help us to do screening so that we can get the right services to the right children, to the right youth, and the most appropriate services that will help them, you know, as I mentioned earlier, thrive.